props. Well, hello everyone. Thanks for hanging out, waiting around through all these presentations. My name's Dr. Joe Olsen, and I'm a pediatrician.
There you go.
You're going to regret saying that later. I'm a pediatrician at Children's Hospital Los Angeles. I'm double board certified actually in pediatrics and adolescent medicine. So I spend most of my days with teenagers by choice. Shocking. And I care for a whole host of populations that really nobody wants to take care of. I take care of young people with HIV that they didn't get from birth. They got from living. I take care of transgender youth. I take care of homeless youth. I take care of kids and youth with chronic pain conditions. So I see a lot of people that no one else really wants to take care of. I want to just read something that I just find profound, and I'll tell you a little bit about it in a minute. So this comes from a body of work that was developed in this country, but it says, no national program of economic security can be regarded in any sense as complete or effective without adequate provision for meeting the risks to security which arise out of ill health. Sickness, the loss of earnings because of the disability of the wage earner, the cost of medical care, these are specters which haunt the lives of the great majority of the American people. Economic insecurity from illness is not the consequence of a depression. It threatens people of small means even in good times. The problem is not created. It is only exaggerated and made more severe in bad times. And these words were written in 1934. Do they sound familiar to anyone? So these words were written by the Committee on Economic Security, and they were supposed to be included in a report that came out with the New Deal. And there was so this committee basically got it right on the money. It was a collaboration of a lot of people, a lot of stakeholders, providers and others who recognized what the issues around sickness, illness, death, and dying were doing to the working class people and everybody basically. And they also put together a list of suggestions to solve this problem or to move forward with this problem. And you might wonder what those suggestions were. And those, not shockingly to a lot of people who do this work, the recommendation was really to have a national health service program. I know that's shocking, right? So a single payer system that basically is basically insured by the federal government, but is decided in its detail among the states. Because each state faces a different issue, different sets of issues around health care. Well, this report was so contested that it wasn't actually included. It was put to the side, and they said, okay, well, after we get the New Deal through, we'll bring this forward. And it was never brought forward. In fact, it was never published until the 70s, until the 1970s. So when I look around, and I really appreciate the comment about the baby. Can't give birth to a baby who's an Olympic athlete. But you also can't give birth to a baby one body part at a time. You can't give birth to a head, a few years later, some feet, a few years later, some arms. It just doesn't work out very well. I have a child. It would be awful, really. Last week, every time I talk about this, I have another story that kind of complements my position. Last week, I had a family who they have an 11-year-old child who needs medication, and they have really actually fairly good health care insurance. And so the mom said to me, Dr. Olsen, can you just figure out if this medication is covered for my kid? And so I called up the little number, the whole, want to be denied, call 1-800-WE-HATE-YOU. And so I called them up, and sure enough, not surprisingly, they said, no, we don't cover that medication. So I called the mom back and I said, the medication isn't covered on your plan. Let me do prior authorization and see if I can get it covered. So I went through that process. Didn't get, got rejected. And then the mom said, well, you know what, it just so happens that I have open enrollment. You know that month, that's so fun. What am I getting, what am I deciding? So So she has open enrollment. She said, if I get, Dr. Olsen, can you tell me if I get this particular plan, will the medication be covered for my kid? And I said, oh, you know what, let me do some legwork and find out about that. That should be easy to find out. Awesome. So I got on the phone and I called again, and anybody who's ever tried to actually access the health insurance industry, you know that it's really built not to access. So I called, there's what's called like a provider customer service line, and you call up and this really pleasant person says, hello, thank you for calling Blue Cross, please put in your national provider information number and we will get to your business right away. So I put it in, because you know I've memorized my own like 12-digit number, whatever it is by now. Put it in and it says, I'm sorry, we didn't recognize your NPI number, could you please put it in again? I'm sorry, we still don't recognize your number. And in order for us to more fully serve you, we have to recognize your number. So at this point, I learned now that you just put in 11111 pound, and it actually punts you to a live human being, which isn't actually a lot better than the recording. And so I said my issue, and I said I have, you know, I'm trying to find out if my patient gets on this different plan, if this medication will be covered. And the person said, can you please give me the ID number of the subscriber? And I said, no, I know that the current plan that they have doesn't cover the medication. I'm just trying to find out if they have, could you please give me the identification number of the patient? No. Okay, so this went on for about 15 minutes. Then finally they said, oh, well, the person you need is the customer service for the plan that they already have, so that they can tell you that this, okay, so then this goes on and on and on. By the way, no one still recognizes my NPI number, which is a little frightening, frankly. So finally, I'm getting more and more agitated, and at some point, I finally said to the next person that I talked to, if I were a totally new customer and I wanted to find out if this medication were covered for myself, who would be able to tell me if this medication was covered for me? And they said, oh, I see, Dr. Olsen, well, you need to talk to the person that sells the policies. And I thought, oh, this is going to be great, because I've actually never talked to this person. So they pumped me to this, and those are like the cheeriest people, right? Because they're like going to get your business. Hey, new sales, Blue Cross. Said, I'm trying to find out if I wanted a certain medication covered by a policy, would it be covered by this? And the mom had given me the name. Would it be covered by this? He said, oh, we don't have that information. And, no, this happened to me last Friday. And I said, well, what do you mean? Who has that information? And then he said, well, that's really embedded information. And I didn't really even understand what that meant. What do you mean it's embedded? Okay, so you're selling the policy and you don't even know what it is. Sir, can I get this car in blue? I don't know. That's embedded information. Do you have this organic bread here? I don't know. That's embedded information. Can you imagine any other situation where you went to buy something and no one knew what the hell they were selling? That's exactly what happened. You know, I never got the question answered. I spent at least 2 hours of my time, which is worth a lot more than I get paid, but still it was worth a lot of money to me. Never got the answer to this question, and I actually had to call the mom back and say, I'm sorry, even the salesperson doesn't know whether this medication will be covered or not. The reason that I bring this up is because this isn't, I want to say that this is not an issue of political party. It's so true, right? You know, when I have patients that are really sick, I'm like, are you a Democrat? Because that's really going to make a difference in how I take care of you. No, the whole point is that this is an ongoing battle between us, the people, and they, the money, the insurance industry that is profiting off of our illness, our death, our dying, our tumors, all of our suffering. You know, when I think about the way that healthcare is delivered in this country, and even though I do agree we have some of the best doctors and we have some of the best care, I think about the fact that we practice it in an immoral way. We practice it because we allow it to be a profit industry. Because we have some kind of illusion in our head that there's competition between the providers to give you the best care. That's not what the competition is. The competition is how much money can we get from you for providing you the least amount of care. That's the true competition that's going on right now in medicine. So while we think about this, ponder this idea about the middleman, this health insurance industry that is profiting from all of these things that are happening, and I tell you that this is not a personal gripe, this is a reality. How many people have read the Obama Healthcare bill? Completely. Fun, huh? Isn't it fun? Okay, so, well, that's good, because in its first iteration, it was 1,920 pages, the bill, when it first came out. And so I bring this with me because this is all blank. I didn't print out the bill because I can't waste that many trees in good conscience. But here was the size of the original bill when it went in, and now it's this size, but you'd have to print on both sides of the paper to fit it on one ream. What's this?
That's the Constitution of the United States.
Isn't that weird? We have a premise to run an entire country and something that you can put in your back pocket, but we can't come up with a health care bill that streamlines it in less than this. This is scary, you guys. This is like 1,000 pages of who can get what and who can't get what. That's what this is right now. It's a bill that doesn't cut out the middleman. It's a bill that still says we're okay with this being a profit industry. And that is my problem with the baby. That's my problem. That the baby is crippled from the beginning. It's not even a baby with potential, because the biggest thing that needs to happen is to cut out the middleman. I want to leave you with a few points because I think they're really important. The current healthcare system in this country, and as it is proposed in the bill that is passed, is economically not feasible over time. We cannot continue to practice the way that we do and continue to survive, because healthcare costs will skyrocket out of control, because we're not putting the money into healthcare, we're putting the money into the insurance industry. It's not about healthcare reform, it's about health insurance reform, and that's a huge difference. Why does Medicare work? Because it's a shared risk pool. If you applied the same principle to everybody in the country, you'd have a huge risk pool which included people at no risk or low risk and people at high risk who need health care. So if you share that cost among everybody, you can provide for everybody during the different phases of their life cycle. A single payer system is not about a single provider system. They're not going to make white buildings with blue stripes that say doctor's office. That's not what anybody's proposing. It's a system of a single payer. So all of the sources of revenue come into a single payer pot, and instead of those dollars going to advertising and those lovely people on the telephone that tell you your NPI is invalid, there would be actual care being delivered to people seeking it. So I just want to leave you with those three ideas, and if I'm available to talk to anybody about this later. I know we're going to get some more detail from Dr. Bill about a single-payer system in this state and for this country, but please, I really want people to take home this message that over time it's not sustainable. We have to do something about it, whether you think about it from an economic perspective or you think about it from a moral perspective. Whatever way works for you, what we're doing right now needs to change. And eventually, we're going to have a national health service program. It's just a matter of when it's going to happen. Thanks.